And this is Dr. Corey Podbelski from Spectrum Physical Therapy in Niantic. I wanted to make another short video today talking about how I educate my patients on pain and pain thresholds. So, we do a fact of the week here every week at Spectrum in Niantic, and one of the facts of the week was talking about some common myths about low back pain, especially chronic low back pain. And one of them was that you don't necessarily have to have a physical injury to have pain in your back. This is especially applicable for someone who's maybe lumped into that category of chronic low back pain. They've been scanned up and down, x-rays, MRIs, and haven't necessarily found anything, and wondering why am I having pain at this point? Why can I only sit for a few minutes at this time before I'm having a lot of pain? Or on the other end, maybe you've been scanned up and down and they found something they thought was relevant to your pain, maybe a bulging disc or something like that, and they've went in and treated it with injections or surgery, and maybe I've ended up in more pain. I'm wondering, if I've had this fixed, why am I still having pain? So what I do a lot of education about is pain thresholds. Normally your threshold should be high enough to do your normal daily activities, maybe sitting in a chair for an hour, sometimes 2 hours at a time at work, maybe bending over and picking things up repetitively. And so normally your pain threshold should be high enough to allow you to do all your daily activities. If you have an acute injury, maybe you've tried to lift something too heavy, maybe you've sat too long, or maybe you've picked up too many things, bent over too many times in a row, your brain may send an output of pain. Now, what happens when your brain sends out that output is it takes your pain threshold and it lowers it down. So now you're only able to sit for a few minutes. Maybe you were able to sit 2 hours before. Maybe you're only able to bend over once to pick something up, and you have that output of pain. Now you have that lower threshold. So there's less activities that you can do before you sense that pain. And so pain doesn't always equal harm, right? So hurt doesn't always equal harm. Pain is just a warning. You may have an acute injury that needs to be taken care of, but if you're someone that's in that chronic low back pain category, and you've been scanned up and down, you don't necessarily have a physical injury, but you still have that pain. You're still only able to sit for a couple minutes. Some of the things we do in physical therapy can help to raise that threshold, to help reset your brain almost. Again, pain is a perceptual event, so it's largely coming from the brain, especially in the chronic low back pain folks. So some of the things we do in physical therapy to help boost that threshold, we do different manual therapy techniques such as instrument-assisted soft tissue massage, dynamic cupping, dry needling. We do different things like joint manipulation, joint mobilization, as well as corrective exercises and doing movements that feel good and help decrease your pain. So basically the whole idea is we're trying to boost up that threshold. Now that threshold will only stay high as long as your brain feels safe. If your brain starts to get back into that alarm phase and that painful phase, then those movements or those postures will be painful again. So what we do is we do a combination of techniques in the clinic as well as giving you things to do at home to help keep that threshold high and help keep your brain satisfied and out of that alarm phase. Again, it's depending on your beliefs, what you've heard from doctors in the past. That threshold may only stay high for a period of time, and it's going to take that positive reinforcement of doing these movements over and over again, which is why we're always stressing to keep up with your home exercise plan and things like that. I do a lot of this education because people get really worried about, why has my back been hurting for 10 years? And it may come and go, but when it comes, it's very severe, and I can only do certain things. Again, pain is a perceptual event. There may be something going on in the tissue, but oftentimes may not be the case. A lot of the things we do here, again, can help raise that threshold. That's why we're always urging you to get PT first. We want you to get in before you get that X-ray and MRI that may cast that negative light in your mind of, oh man, I must have something wrong in my back. Because a lot of times, just with simple exercises, simple manual techniques, we can help raise that pain threshold and keep it higher so you're able to get back to your activities of daily living and things that you have to do throughout your day. So I hope this was helpful. If you have any questions, you can comment below and let us know. Thank you.